Welcome back, everyone. Today, we're going to talk about a career in nursing in the USA in just 7 slides. Now, if you happen to be from outside the US, please post in comments below about what you would like to know more about, and we'll talk about that soon. When we say nurses, we mean registered nurses, also known as RNs. Advanced practice registered nurses are known as APRNs. An APRN refers to a registered nurse with more advanced education and training. They have a larger scope of practice than RNs. In this session today, we're going to talk only about RNs, and we'll discuss the APRNs in a later session. Registered nurses form the fifth largest occupation in the U.S. and is also the most trusted profession here. Nurses monitor and manage patients, and they work in many different settings that include hospitals, clinics, schools, nursing homes, clinical research, pharma companies, and so much more. Their median annual salary is $86,000, much higher than the national median of $60,000. We have around 3 million nurses in the U.S., and the job growth is 6%, which means about 194,500 openings are projected each year. The occupation is still predominantly female, with an 88-12 ratio. How to become an RN? Well, there are different educational routes to become an RN, though the responsibilities and salaries differ. We can have a different session just on these different educational options. You can either do an associate's or a diploma or a bachelor's degree. After completing education, you have to pass the national licensing exam and obtain the state license where you want to practice. Like other healthcare professions, nurses too need to renew their license by earning a certain number of hours of continuing education. Lastly, we must add nursing is a rewarding profession where you are helping people and saving lives. Jobs and salaries are pretty stable, although annual raise in salary is limited, which means even though you might start higher compared to your non-healthcare friends, their salaries will eventually catch up and likely exceed yours. So we feel this job is for those who are really compassionate to others and can stay motivated to help them despite several challenges. And that's all we have today. Any questions or comments on what you would like to hear more or less of, please post in the comments below. And quick disclaimer, everything we say here is from information only based on what we have researched. Please make your best judgment before deciding what career is best for you. Thank you very much.